Akwaba. Hello family, welcome to the Actual Medical Show.
Today, we are talking about a very important condition that many might have heard about but do not understand. Sit tight as I take you deeper into the world of knowledge. My name is Stephen A. Antwabam, and this is your show, the Actual Medical Show. Imagine living with a disease for many years without ever feeling sick. No pain, no fever, no warning signs. Yet, quietly, this disease is damaging one of your most important organs, your liver. This is the reality of hepatitis B, often called the silent killer. Though there are many other diseases that are referred to as silent killers, and hepatitis B is one of them, because many people do not realize they are infected until serious complications appear. Before we move on, I would like to point out that I'll be using some abbreviations like HBV, which means hepatitis B virus, WHO, which means World Health Organization, HBsAg, which means hepatitis B surface antigen, anti-HBc, which means hepatitis B core antibody, and anti-HBs, which means hepatitis B surface antibody. So kindly take note. Hepatitis B is caused by the hepatitis B virus, HBV, a virus that attacks the liver. It can cause acute infection, which lasts for a short period, or become chronic when undiagnosed or untreated, meaning it remains in the body for life. Chronic infection can slowly lead to liver scarring, cirrhosis, liver failure, or liver cancer. To understand how serious hepatitis B is, let's start with what the world is facing today. Hepatitis B is a global health burden, and the numbers tell a powerful story. According to the World Health Organization, WHO, hepatitis B is one of the most widespread viral infections in the world. In 2022, approximately 254 million people were living with chronic HBV. That's roughly 3.3% of the world's population. This tells you that hepatitis B is not a small outbreak or an isolated problem. It's a global challenge. It doesn't stop there. Every year, about 1.2 million new infections occur. In 2022 alone, hepatitis B caused an appalling 1.1 million deaths. These deaths are mostly from conditions that develop quietly over years: cirrhosis, liver failure, and liver cancer. But hepatitis B is not evenly distributed across the world. Some regions are hit much harder. For example, the Western Pacific region carries the highest burden with 97 million people living with chronic HBV. The African region, where you and I reside, follows with 65 million people. Other regions include Southeast Asia with 61 million people, Eastern Mediterranean with 15 million people, Europe with 11 million people, and the Americas with 5 million people. When we look at these numbers, one thing becomes clear. Hepatitis B is not a disease affecting just a few communities. It's a global public health crisis. Now, let's look at how hepatitis B spreads, understanding the routes of transmission. To protect yourself and your loved ones, it is very important to know how the virus spreads. HBV is found in the blood and body fluids of infected individuals. Therefore, transmission can happen in several ways, some of which may surprise you. Let's look at them one after the other. Number 1, mother-to-child transmission at birth. This is the most common route in areas where hepatitis B is widespread. This is because if a baby is born to a HBV-infected mother who is either undiagnosed, untreated, or not monitored, the baby can easily become infected during childbirth or whilst coming out from the birth canal. If that happens, the child has a 95% chance of developing chronic hepatitis B, because the younger the person is at infection, the higher the risk of developing chronic infection. Number 2, early childhood exposure. Before I move on, if this video has blessed you, please share so that others can also learn what you are learning and more. And don't forget to like, comment, and subscribe to my channel. Thank you. In many communities, young children are exposed to infected blood or bodily fluids through small cuts, sores, or sharing personal items, especially when playing. These early infections often lead to lifelong chronic disease, especially when they go undiagnosed or untreated. Number 3, contact with infected blood or bodily fluids. This is possible through the following means. Number 1, unsterile injections. This is common among drug abusers who share needles and other sharp objects which have contact with blood. Number 2, contaminated medical or dental instruments. This actually is uncommon, however, still happens, as many hospitals may or may not fully follow provided guidelines for sterilization of equipments. Number 3, shared hair clippers. This is very common. Many people go to the barber's shop to barb hair and use the general clipper, which may not be disinfected, and even when disinfected, it may not be done properly. Hence, it is important that every individual get his or her own hair clippers for barbing to avoid stories that touches the heart. And if you are unable to do that, make sure your barber do a good job at disinfecting his clipper before using it on you. Number 3, tattoo or piercing tools that are not properly disinfected. Number 4, blood transfusions that have not been screened. Other common ways include: Number 5, sexual transmission. Unprotected sexual contact with an infected person whilst you are not vaccinated can cause the transmission of the HBV. Understanding these routes helps individuals and health systems focus on prevention, vaccination, and safety practices. Let's talk about the symptoms of hepatitis B, or the lack of them. One of the most confusing aspects of hepatitis B is that many people feel completely healthy, especially during the early phases. A person can carry the virus and pass it on without ever noticing symptoms, and this is because they may never be sick or show any sign of complications that may raise an alarm. However, when symptoms do occur, they may include yellowing of the skin and eyes, which is known as jaundice, dark urine, extreme tiredness, nausea and vomiting, and/or abdominal pain. But here's the key point. Most chronic carriers have no symptoms for years or decades, and by the time symptoms finally appear, serious liver damage may have already taken place. This is why this condition is referred to as a silent killer, and this is why testing and regular medical checkups are so important. Before I move on, if this video has blessed you, please share so that others can also learn what you are learning and more. And don't forget to like, comment, and subscribe to my channel. Thank you. Let's talk about diagnosis and treatment and why so many people are undiagnosed. Even though nearly 254 million people live with chronic HBV, only 13% know they have it. That means almost 87% of infected individuals are unaware and unmonitored. Worse still, only 3%, just 7 million people worldwide, are receiving treatment. So some are unaware of their status, while some that are aware decide not to get treated and spread the disease. And this is why you must be careful when interacting with people whose status is unknown, especially if you are not vaccinated. Diagnosis of hepatitis B requires blood tests that detect HBV markers, for example, the HBsAg, anti-HBs, anti-HBc. Doctors may also scan the liver using abdominal ultrasounds, abdominal CT scan, or other tools to check for liver damage or the extent of it. What are the treatment options available in case you have this condition? Actually, as at the time of doing this video, there is still no complete cure yet. However, existing approved treatments can effectively manage the condition, suppress the virus, and prevent severe liver damage, but they do not eliminate it entirely from the body. When taken correctly, these medications slow down liver damage, reduce inflammation, lower the risk of cirrhosis, lower the risk of liver cancer, and improve long-term survival. Most patients will need lifelong treatment, especially those with advanced disease. Before I move on, if this video has blessed you, please share so that others can also learn what you are learning and more. And don't forget to like, comment, and subscribe to my channel. Thank you. Let's look at the importance of regular medical checkups, early diagnosis, and immediate treatment, and how they improve prognosis. Let's make this interactive. Imagine two individuals. Person A, who was diagnosed early, monitored regularly, and start treatment just in time to prevent complications. Person B, never got tested, never monitored, only discovers HBV after developing liver cancer. You must know by now that both individuals may look and feel the same for years, since they may not show any symptoms, but their destinies are completely different. And here's why early diagnosis and regular checkups make the difference. It is important to know that regular checkups prevent silent damage. Even when someone feels perfectly fine, the hepatitis B virus may be actively damaging their liver. However, routine checkups allow doctors to monitor viral load, detect early signs of liver inflammation, identify fibrosis or early scarring before it worsens, and catch liver cancer early while it is still treatable. Without checkups, disease progresses without warning, often until it becomes life-threatening. Believe me, you don't have to wait that long. Also, early treatment saves lives, and the statistics prove it. A major study involving 855 adults with chronic HBV revealed something remarkable. Among those who received antiviral treatment early, only 3% developed liver cancer after 5 years, only 4% after 10 years, only 9% after 15 years. This means that early treatment reduces the risk of liver cancer by up to 70%. That is not a small improvement, it is life-changing. Also, monitoring before treatment is just as important. Some individuals may not need treatment immediately, like I said earlier, especially if the disease is in its acute phase. But no treatment now does not mean no checkups needed. Studies show that increasing monitoring frequency in people who are not yet eligible for treatment can detect cancer early, prevent cirrhosis, improve treatment outcomes, and reduce deaths significantly. In fact, in one model, for every 100,000 adults with chronic HBV who were monitored closely, thousands of cases of cirrhosis, liver cancer, and HBV-related deaths were prevented. This shows you the role of recurrent follow-up even after diagnosis. Here is an important reality. Discovering hepatitis B too late leads to poor prognosis. Many people in low-resource areas or those who are ignorant about this condition only seek medical attention after symptoms like swollen abdomen, jaundice, or vomiting blood appear. At that stage, the liver is often severely damaged and treatment options become limited. But if the same individuals had been diagnosed early and monitored regularly, the outcome could have been completely different. Let's talk about prevention, the most powerful weapon against HBV. You've heard the saying, prevention is better than cure. It's not just a saying, it is a powerful reminder of what is needed to be done. And the safest prevention against HBV is the hepatitis B vaccine. The hepatitis B vaccine is one of the safest and most effective vaccines ever developed. It is so safe that WHO recommends the first dose within 24 hours of birth, followed by 2 to 3 additional doses over the next months. Once vaccinated, a person is protected for at least 20 years and often for life. Now, if babies can take this vaccine, my friend, what is your excuse? Other preventive steps include practicing safe sex, using sterilized medical and tattoo equipment, screening all blood donations, and ensuring that as a pregnant woman you are tested and treated to prevent mother-to-child transmission. Please note that prevention remains the best defense, but early diagnosis and monitoring are the next most powerful tools. Final thoughts. What this means for you and your family. Hepatitis B does not have to be a death sentence. It does not have to progress silently until it becomes liver cancer. With the right steps, the outcomes can change dramatically. Here's the bottom line. Get tested even if you feel well. If you are positive, commit to regular medical checkups. If treatment is recommended, start early and stay on it. Ensure newborns and infants receive the hepatitis B vaccine. encourage community awareness. When we take these steps, the silent killer becomes a manageable condition, and millions of lives can be saved. If you enjoyed this video, please like, share, comment, and subscribe to my channel for more. Thank you.